2030 up move. But let's get you a CNBC TV18 exclusive now. Sources are telling CNBC TV18 that insurance companies could be looking at cutting commissions. Yash is now joining in. Yash, you were just telling us yesterday that the IRDAI was sort of in discussions with insurance companies, telling them commissions are high. Look at a model which is similar to the mutual funds with a capping of the total expense ratio. What have you heard back from the companies now? What are they planning to do?
Well, yesterday it just coincidentally happened that we were told by our sources, a development in terms of the discussion between the regulator and the insurance CEOs when it comes to the concern around high commission cost, high distribution cost, and how that needs to come down. In a separate development, the two are not related, but move towards the same direction. After the GST changes, which the government had announced, putting GST on health insurance to exempt category from 18%, we understand all insurance companies have passed on the benefits of that entire 18% GST cut to the policyholders. What that means is there is, according to our sources, a hit of anywhere between 5% to 8% in terms of additional cost for insurance companies, depending on how big their retail book is. Now, what we've been told by our sources is that the chief distribution officers of all large insurance companies have been discussing, have been talking since the last few days. And the idea is how this cost can be shared with distributors like web aggregators, like banks, like insurance agents. And that is because commission is still not exempt, though reinsurance is exempted, but commission is still not exempted from GST, and hence the cost burden being passed on to various kinds of distributors. What we've been told by our sources is that the insurance companies are looking at passing on, or rather cutting commissions by about 5 to 8% when it comes to the commissions that they pay to web aggregators, banks, as well as individual agents. What we've been told by our sources more specifically is that the pass on of the commission cost to agents as well as banks will be much lower, but the pass on to web aggregators could be much higher because agents are proxy employees in a way for insurance companies, and hence the pass on of the additional cost of this 5 to 8% reduced commission could be much higher as far as web aggregators are concerned. Now, this decision will be communicated to all distributors by all insurance companies collectively, and that, according to our sources, could happen very, very soon. Importantly, one of the only web aggregator listed, Policybazaar or PB Fintech, has indeed a large proportion coming from health insurance, about 20% of its revenue as well as 60% of its value. Of course, will impact all web aggregators, but the listed one in this space is certainly Policybazaar. We've written to Policybazaar on this query, but a response from them is still awaited.
Okay, all right, got it.